Dr. Erica is here from St. Vincent Healthcare, and today we're talking about decreasing the risk of dementia. And it turns out fate's in our hands when it comes to this kind of thing. Sometimes
we can. You know, another big study came out recently looking at dementia, and we've already known that a healthy lifestyle can decrease the risk of dementia. But this study that came out in the Journal of the American Medical Association a couple of weeks ago really also looked at people with a genetic risk of dementia. I get a lot of people who've taken care of their parent who's struggled with dementia, and they're terrified of having the same symptoms or developing the same problems. And so what this looked at was lifestyle, 5 lifestyle modifications, and whether or not that can substantially decrease your risk of dementia. And what it showed was, again, significantly engaging in these lifestyle habits can decrease the risk of dementia, even in people who have a genetic risk for dementia. You can turn some of that around. So what are these 5 things? No smoking, limiting your alcohol, healthy exercise, healthy diet, and then brain games. And I think we have a couple slides that go into a little more detail on that. If you're a smoker, you've already doubled your risk of developing dementia, so quit smoking. It's not too late to quit. 1-800-QUIT-NOW or talk to your doctor. Alcohol, you know, they actually allow up to, they favor wine for your brain and allow up to 7 drinks per week. So if you like your alcohol, limit it to 1 drink per night and choose wine over that. The diet, we've talked about this on here before, but the Mediterranean diet, the DASH diet, and then they actually came out with one called the MIND diet that you could even look up, and it really favors green leafy vegetables, berries, whole grains, nuts, limiting your fried food, or eliminating fried food, but limiting your red meat. You know, you can still have your red meat for sure, but just not every night. And they have shown that that can decrease the risk of dementia. And then looking at exercise, 150 minutes per week of moderate to vigorous exercise is really what you need to kind of fall into that category where you're going to get that lifestyle benefit and that memory benefit. And that's where you are exercising, but you probably couldn't sing a song, or you're having a hard time saying a full sentence without taking a breath. And that, then you know you're really getting that moderate to vigorous exercise. And then if you are smartphone or computer savvy, look online for mind games or brain exercises. There are several apps that you can put on your phone or ones you can do on the computer. And then just being socially active. And if you play cards and keep reading and do crossword puzzles and do everything you can to keep your mind activated, we know that this can all substantially decrease dementia in people who are at risk of dementia from a family history, as well as just the general population.
All right. Well, Dr. Erica, thank you so much. Appreciate it.
You're welcome.
We'll be back after this break.